Thank you, Honourable Speaker. CBC has reported measles outbreaks across the province, notably in spaces such as emergency rooms and schools. The Canadian Journal of Public Health has highlighted that vaccination rates for 2-year-olds have noticeably lowered since 2019. This is very worrisome, as Manitoba has reported over 200 cases of measles since the beginning of the year. What is this government doing to educate and encourage our population to prevent the further spread of measles?
The Honourable Minister of Health, Seniors and Long-Term Care.
I want to thank the member for Tyndall Park for that really important question and timely question. We are in a time of year where we're encouraging Manitobans to get vaccinated. We've been working really hard with our public health experts and our Chief Medical Officer of Public Health, Dr. Rusin, to make sure that Manitobans have access to the information that they need to make the most informed health decisions to keep themselves, their loved ones, and communities protected, safe, and healthy. As a government, we've taken steps to make sure that the measles vaccine is more readily available in communities where we know that there are increased cases, and we have public health workers who are going out in community, meeting people, face to face, hand by hand, to make sure they have the information to make the right choices to stay protected. So go out, get vaccinated. Now is the time.
The Honourable Member for Tyndall Park on a supplementary question.
Thank you, Honourable Speaker. Measles is a highly infectious disease that spreads very easily and often results in high fevers, rashes, and in extreme cases, pneumonia, brain swelling, or respiratory failure. These are extremely dangerous for affected children, and we must remember that these are conditions that can reoccur into adulthood. Can the minister share what steps they have made in tracking outbreaks and protecting the public?
The Honourable Minister of Health, Seniors and Long-Term Care.
Really important question. I want to thank our public health experts and the public health nurses, several of which I actually just met with a few weeks ago, who do the work of contact tracing, going out in communities, making sure people have the information they need. They follow up with families, they follow up with sites, they get the information out there by way of bulletin regularly where it's needed. We want to make sure that we're providing people the information that they need, but we're staying on top of measles and other communicable illnesses in our province to keep people safe. I want to acknowledge that there was a tragic death of an infant in Alberta, measles related. That is an absolute tragedy. Measles is preventable for so many people if we are vaccinating at the rates that we need. It's part of the reason why, as a government, we've been very clear that we stand with science, we stand with experts, and we advance their clinical expertise.
First time has expired. The Honourable Member for Tyndall Park on a final supplementary question.
Thank you, Honourable Speaker. Over the last several weeks, there have been numerous articles about the measles outbreaks here in Manitoba, across Canada, and around the world. The Government of Canada reports Manitoba to be the 4th highest measles outbreak source, and the World Health Organization shows Canada being the 9th highest in global cases. Can the minister share with the House what information and details will be made public and when we will have access to this information?
The Honourable Minister of Health, Seniors and Long-Term Care.
Honourable Speaker, we have been working very hard to make sure the information is readily available for the public. We're working with public health nurses and experts to make sure that we're taking a more modernized approach as a government so that the information is accessible. You can go on our Parenting Manitoba website to get the information in many different languages. It can be translated in real time for those who need it. As a government, we know that information really is what we need to get in people's hands so they can make the best decisions to keep themselves and their loved ones safe. I'm asking people to go out and get vaccinated. Talk to your nurse practitioners, your pharmacists, your primary care providers, doctors. Get the information you need to make the best decisions for you and your families. On this side of the House, we stand with science. We did not see that, unfortunately, from members opposite during COVID.
First time has expired.